21st Century Entrepreneurship with Martin Piskarik.
I would love to see everybody benefit from chiropractic care um, on the level of improving health, well-being, and vitality. I really feel as though chiropractors will be the leaders in healthcare of the future because more and more people are moving away from a disease model where people are not just wanting uh, a solution for their health problems of ailments, but what can I do to become healthier? What can I do to let my body be stronger? How can my body adapt to the world better? How can I perform better? And chiropractic as a service aligns itself directly to that. So I guess that is my highest value is more people can benefit from chiropractic care to optimize their health, well-being, and their human potential by utilizing chiropractic services literally from the day you're born till the day you die. Most people don't think of children benefiting from care, but that really is a real magical time for people to receive care. We're right now at a an interesting point of human culture. Uh, Life expectancies are dropping. People who are now having children, it is more likely that those children are going to die sooner than their parents will at a younger age. The life expectancies in our world are beginning to decline. And there are a multitude of reasons for that, but a lot of it, in my opinion, is due to how we've looked at our bodies. We rather than doing taking care of our bodies to perform at its optimum, we wait until we have a problem, wait till we have an ache or pain or some disorder that then says, "Oh, I need to go to the doctor." Whether that be blood in the stool, difficulty breathing, overwhelming headaches, or whatever the symptom is. You wait until the symptom happens rather than doing things proactively to care for your health and well-being. And that lives in every level. But yeah, yes, in terms of going to doctors or healthcare providers, but that even means taking care of yourself. How many people don't start exercising until they have a heart attack? Or how many people don't wind up cleaning up their diet until they realize they have some health issue that they need to deal with? More and more people today are becoming conscious of the fact of it matters what I put in my mouth. It matters how much movement I get in my life. It matters how much rest I get. All of those things. We're at a cultural point where people are seeing, I need to care for this vessel of my body. And that crisis care, although we need it, that's our whole healthcare system is built on crisis. You don't do something till something happens where you're falling apart. So this idea of self-care has been an outgrowth of saying, I don't want to wait till I'm in crisis. Well, I'm proposing and can validate this that we need to start utilizing professionals for healthcare. We have more people going for yoga classes, meditation classes, personal growth classes than ever before. People are wanting to do stuff. I believe you can go to other healthcare providers, not just to prevent disease, but to optimize your well being. And that's the role that real magic of what chiropractic care plays. That rather than going to the chiropractor when you have a problem, you go to a chiropractor on a regular basis to ensure the health, well-being, and the vitality of your spine throughout your lifetime. People do it for our teeth. Yes, you can go to the dentist when you have a toothache, but you can go to a dentist and a hygienist to take care of your teeth so you don't get problems. But the real magic is going to the dentist, go to the hygienist, and caring for the health and well-being of your mouth to optimize the health and well-being of your mouth. Okay, so the dental profession has done a great job of building that awareness that not only are we here to fix problems when they happen, prevent problems, but we're here to optimize and maximize the health and well-being of an important part of your body. Well, I'm going to propose to you, I'm not saying the teeth aren't important and your gums aren't important, they absolutely are. But the spine is connected to every other function in your body. Your spine and the way the structure protects the delicate nerves inside the body is such a critical part of how everything in our body happens. Everything from how we digest our food, how we move, how we sleep, how we have relationships, how we think is all connected into that nervous system. Care for that nervous system and optimize the well-being of the spine, and you're going to create a healthier human being. And not just a human being that's going to have less health problems, but who's going to function at their potential. And we're actually witnessing this. I mean, there's most athletic teams have a chiropractor, or professional athletic teams have a chiropractor, not just to deal with injuries and recover from injuries, but because they see the performance be better. Their reaction times are quicker. They jump higher. But the performance of the body elevates when you keep the spine in tip-top tuning. So that really is the magic of what we have to do. And that's true healthcare. And chiropractor is not the only profession that fits into that. You can go to an acupuncturist to optimize the health and well-being of your body. You can go to a massage therapist to optimize the health and well-being of your body. You go to a physical therapist to optimize the health and well-being of your body. So I believe that our culture is beginning to recognize the need for having coaches and support within your physicality and your psychology as well. So chiropractic plays a leadership role in this. And in my role as president of a chiropractic college is to prepare this next generation of leaders in healthcare, to really recognize that people need more than just crisis care or the prevention of crisis, but they want to optimize their health and well-being. And the huge magnifier that's actually happened over the last few years through COVID. More and more people, when I was in practice, and more people recognize, wow, we're spending all this money, all this energy trying to avoid or rid the world of a virus, and we're putting no energy to elevating the health of the body. And I'm not saying COVID isn't real. Of course, it's real, but viruses have been around on this planet for centuries, longer than human beings have. Our body is to be in symbiosis with the world, and let's find ways for the body to adapt better, to do what it needs to recognize agents like viruses and be able to build the immune competence and the strength of the body, so people don't need to get sick but can function optimally. Many people view that what a chiropractor does is on a very physical level. And although we do make very powerful physical changes, the body isn't just a physicality, it's mind, body, and spirit all together. And the human nervous system, the brain, the spinal cord, and the branching network of nerves into the body is that connection between the physical and the non-physical aspects of who we are. So when we're going through a psychological or a psycho-emotional experience, that psychology manifests within physical form through the brain and the spinal cord. When we suppress thoughts and feelings and push them to the back of our mind, the back of our mind is actually in our spine. And you can even see it in the postures people hold. A person's posture dictates their life. You see a person who's bent over, a victim, is very, very different than a person whose chest is open, wide, and breathing deeply and expressing themselves. So the spine is a very powerful window, not just in terms of the physicality, but also into the psychology as well. That all thoughts, feelings, and emotions all are stored within the system called the nervous system. Now, the question people ask me is, so you treat psychological problems? In reality, chiropractors don't treat any problems. But I have seen that as people begin getting their spine taken care of, physical problems change, psychological problems change, emotional issues change, because it's all one system. One of the challenges we've had in our world is we've tried to fragment things. We've said, oh, that's a mental problem, or that's a physical problem, or that's a back problem, oh, that's a sinus problem. The body is one integral unit and works together intimately. And the dynamics that occur, everything physical affects the non-physical. Everything non-physical affects the physical. There's an intimate relationship with all of these. And the doctor of the future, the doctor that's needed in this healthcare system, is somebody who recognizes that. So even though what chiropractors do really it targets a very physical aspect of the body, the human spine, its impact and its ramifications are global within the entire body. So a term that gets utilized a lot nowadays is holistic care. And the implication in that is holistic care is care that uh, encompasses everything. And many practitioners feel as though they need to do everything within their practices. Um, Holistic care, how I'm choosing to define it, is more recognizing the whole with whatever intervention you do. So even if you are going to prescribe a pharmaceutical, if a medical doctor is going to prescribe a pharmaceutical, a holistic window is recognizing that that pharmaceutical just doesn't affect one part of the body, one chemical in the body, it affects an entire body. It's in that same vein, chiropractic care is putting a very specific force into the body to allow the spine to reach a better state of adaptability, more flexibility, a better sense of coherence. But as we put that force in, we need to recognize the entire body and the entire person, both physically, mentally, socially, all aspects of the being need to be addressed. That's what a holistic perspective is. As a recipient of care, we need to recognize that whatever we do affects all parts of us, mind, body, spirit. It affects our psychology, it affects our emotional state, it affects our spiritual well-being. Everything that we do physically affects the non-physical, and things that we do in the non-physical world also affect the physical. That you can't separate them. That perspective is so ripe in our culture and amongst practitioners. But from a practitioner standpoint, it's critical to recognize that doesn't mean you got to know everything about everything, okay? But to know that your input into that system, whatever part of the system you're dealing with, whether it be in the structure, the nervous system, with therapies, with body movements, with whatever they are, is affecting the whole being and can see improvement in the entire being. And we need to have clear measures and metrics of our particular specialty, of what we are doing, that allows us to know that we've made positive input into that system. And to merely utilize symptomatology can sometimes be misleading. That a person being relieved of symptoms doesn't necessarily mean that you've created a better being. All it means is the symptom isn't there. And then you can even step back and say, what's the purpose of that symptom? And get into a very psycho-spiritual context in terms of why symptoms and problems even exist. I'm not going to go there today. But that holistic idea is something that people need to have for their own selves, practitioners need to have, and it's that mindset I need to hold in the mind of my students. Because many students start into chiropractic school saying, I want to be a natural alternative to drugs and surgery. And they get here and they begin to realize, oh my goodness, it's a whole different perspective. It's a whole different way to look at things. It's a whole different way to care for people. So not only is it like a natural treatment, if you will, to ailments, but it's a way to actually look at the body differently, how we live our lives differently. And the core value of that comes into recognizing that there's a brilliant intelligence that has designed our world, that our world is created out of an intelligent organization, and to really come into witness of that. And that we all need to recognize that as much knowledge as we have, as much as we know, there will always be more that we don't know. And I'm minimizing the importance of knowledge, of research, of data, of information. But I am being really clear to say that regardless of the amount of information that is here, the design of the body and the design of our universe is much more organized, much more succinct and put together by a mind much greater than any one of us, or even the collectiveness of us. And it's that space in the core of chiropractic philosophy that recognizes that there's an intelligence that has created this universe that we are a part of. And that the more that we align ourselves to the brilliance and the genius of our life's creation, that the more that we're aligned to the natural laws of our world, the more that we can maximize the input that we give into the system. And that's the thing that I hold sacred in terms of how we do, why we do what we do at Life Chiropractic College West. As we say, grounded and anchored in that philosophical recognition, so that as we gain in our knowledge, we don't attach our ego to it. That we grow in our knowledge and come into this place of appreciation of the brilliance of the design of our universe, rather than saying, I know the right thing. Okay. We know the right thing of how we can give input into that body to allow it to be in a better place. And when we do that, we know that we've done something constructive. We know that we've done something that elevates the adaptability, the functionality, the resilience of the human body and the human experience. That's what we know. But the genius that runs that body knows a hell of a lot more than me. People will come to me and says, "Oh, if doing this gonna make my diabetes stop, or make cancer go away, or make my headache go away?" My God honest truth is I don't know. What I do know is we're going to take pressure off your spine. We're going to allow your spine to be more adaptive to the world. We're going to raise the level of vibration that's inherently existing within your body, that it's capable of. And let's come into witness of the magic of what your body is capable of doing. And that places a great degree of wisdom onto the patient, and empowers the patient or the person that we're serving to feel in control of their body, that it's not a doctor who's fixing them, that their body is what's allowing their body to express life better, and they're utilizing me or my service as a chiropractor to help attain that I'm the coach, I'm the consultant, I'm not the controller. We will very often say that human beings need to fit into some predetermined normal. A person's blood pressure needs to be 120 over 80. A person's pulse needs to be so many beats per minute. A person's body chemistry needs to be at a particular place. A person's spine needs to have specific curves. A person's gait needs to be a particular way. And I'm not saying any of those things are not absolutely true, that there is a place of where we've seen the averages and we've seen where most people fall into a category. But we also need to recognize the appropriateness of anything for a given individual. If right now I ran around this building 25 times, assuming I didn't pass out, my blood pressure would change, my body chemistry would change. And they should change based upon the needs of the body at that moment. The same thing would happen. You can do a blood test and see all sorts of abnormal values, but they may be very appropriate for that person at a given moment in time. The same thing is absolutely true regarding the person's spine. That we need to recognize that it is going to make its changes based upon where a person is within their life, the stressors that have come within their lives, how they've carried their posture, how they're living their lives, what their relationships are. There's so many factors that are there, and there's the part of me that says, "Oh, that bone should be in that location and not this one." Or that curve should be like this, and we strive to bring it into that place, but it may not be appropriate at a given moment in time to do that. And that is the true artistry of melding the left brain and the right brain. Because the left brain is going to utilize the data and the information and the accumulated data that we have of that particular mode of intervention to see where does the person deviate. Okay, are things okay? But then the right brain recognizes the needs of that person at a given moment in time. And that melding together of the data with the non-data, if you will, the more intuitive side, is really the magic of what the role of the caregiver needs to be. That it's not just about taking a person and putting him into this box of saying, you're here and we're gonna fix you and make this change. We're gonna give you these vitamins or these chemicals or these adjustments or these therapies and objectively move you from here to here, as much as the input is precisely that. And just to say, well, ideally this is where we would like to be. And it appears to be that your body can handle this input. What happens when we do it? And to come into observation, and if the body resists it, maybe we need to rethink how we engage. And that's the artistry that we need to build within all of our caregivers. Particularly, that's my goal with my students here. But to become the real balancing of yes, you need the data, the information, and all the logic, but you need to bring this into this connection of recognizing that these are human beings and not just machines and not just chemicals and not just bones, but it's an integration of that whole human being that we are caring for. In that is the relationship. And something that we oftentimes don't even look at is the doctor-patient relationship or the caregiver-recipient of care relationship. The dynamic between those two individuals is a sacred time. That this is a person looking for answers or direction or support or coaching. And it's not just about reaching this objective of better spine or better body chemistry or better psychology, but it's more a process of how can we engage in relationship that allow you to move to a more constructive place, and requires doing as much as listening, really participating and engaging with the human being, and that intimate connection between the recipient of care and the provider of care is a sacred one. And unfortunately, in our system, our healthcare system is falling apart. That we're trying to manage the care, that a third party is saying, oh, this is the treatment you need, this is how many visits you need, this is, and we're robbing the system of the most sacred relationship, and that's between the caregiver and the recipient of care. To all of the listeners of this podcast, I encourage two things. One, consider chiropractic care with a chiropractor who holds this mindset and this philosophy for yourself, for your family. In my opinion, one of the greatest bits of health assurance that an individual can have is to have a healthy spine and make sure that spine is cared for by a chiropractor from the day you're born to the day you die. When I was in practice, a full-time practice, 30% of my practice was under the age of 15. Lots of children, infants, and babies. Very often parents started care because they were coming with a problem. But once they realized the true benefit of chiropractic care, they said, wow, this will probably be beneficial for my children. And they recognize the importance of having a healthy spine throughout your lifetime. We do it for our teeth. We should be doing at least that for our spines. So consider chiropractic care for yourself, for your family, at every age. The other thing is, if you're looking to serve the world with an absolutely amazing skill set that you use your hands, All you need is your hands and your heart to be able to serve people and make a powerful difference within their lives. Consider Chiropractic College. It is a 4-year program after prerequisites and an absolutely amazing student experience. My goal, and I tell this to every student who starts in my program, I said, 4 years from now, when I hand you a diploma, I want you to look behind yourself and say, oh my God, these are the 4 best years of my life. Because not only will you learn a skill set and a communication ability, a way to connect with people, but you grow as a person. That part of the job of an institution, any institution, but particularly here, is to hold up a mirror to somebody so that they can see who they are, what drives them from the inside out, and to connect with that magical being. We all have the spark of light that we are born with, and we each bring a different radiance into this world that is unique to each of us. I believe that this is a beautiful profession to be able to express that genius, but part of it is coming into recognition of that. And so I really pride myself in the ability of allowing my students to become introspective, to grow as a person. Because the more that a person grows and heals their own life, the more that they can serve as a role model in their society to help other people do the same.
21st Century Entrepreneurship with Martin Piskarik.